Welcome to the Upgraded Executive Podcast. We are bringing you experts from around the world so you can optimize your mind, body and soul. Our guest today is Dr. Joel Kahn, a medical doctor, a practicing cardiologist and a clinical professor of medicine at Wayne State University. Welcome, Dr. Joel Kahn, to the Upgraded Executive Podcast. It's wonderful to have you here.
Well, thank you. Across the ocean, but we're one united world more and more as we're finding out, for good and bad, but we'll focus on good today.
Very good. Joel, could you give the audience a little bit about your background and how you got to where you are today?
Sure. I'm wearing a white coat, not because I'm a baker, but because I'm a physician and I specialize in heart disease. I'm a cardiologist. I grew up outside of Detroit, the Motor City, the Motown City. I still practice just outside of Detroit. In fact, my office I'm standing in is about 3 miles from my childhood home. I went up to Ann Arbor to study medicine, moved to Dallas, Texas, moved to Kansas City. And long ago, 30 years ago, I came out ready to practice. And my specialty was heart attacks. If you had one, I knew how to put a balloon in any artery in your body, 3 in the morning, 3 at night. And I did that for a long time with a lot of success, helped a lot of people. Great adrenaline rush. You know, that's called angioplasty. That's called stenting. You have many fine practitioners of that art. And some of the original work was done in the UK for sure. Along the way, the other kind of path was a personal path where about 43 years ago, I stopped eating animal foods. It was actually partly religious. It wasn't a strong animal rights or health issue. It was a reaction to the food choices in my dormitory at the university, actually, at a great salad bar and nothing else. But that became important to me, actually, because although I began practice in 1990, there was a paper published 3 weeks after, July 1990, that is called the Lifestyle Heart Trial. I read it, not knowing what I was about to read, but it was a very high-tech science study of the ability to reverse blockage in arteries using diet, fitness, stress management, ahead of its day. Although you could say we've known many of these fundamentals for a long time, but it was a well-done study. So I've had the pleasure of being kind of a high-tech guy all through this, using CAT scans and stress tests and echocardiograms and all, but also a really kind of high-touch, always teaching my patients as soon as I realized there was a therapy, nutrition and fitness and sleep. And as time gone by, I've kind of shrunk the cath lab work and upped the preventive work based on a couple statements. I love the hashtag. I use it. I can't really claim I created it. Prevent, not stent. That's one of them. And test, not guess. You know, we take the precision of making a car much more seriously than the precision of analyzing our own bodies. We don't have to be so imprecise. But also, I'll just say one last thing. There was a famous event in 1955 in the United States when our President Eisenhower had a massive heart attack and could well have died during his presidency. He got excellent counseling from a Harvard professor, Paul Dudley White, a world traveler, been to England many times. I've seen pictures of him, lectured all over the world. But anyways, Dr. White announced to the world, heart attack after age 80 is an act of God. A heart attack before age 80 is a failure of the medical system. That was in 1955. And that vision has kind of been lost because we hear about people all the time, celebrities, sports athletes, or just regular people, school teachers, firemen, police officers, you know, moms and dads that have heart attacks, bypass, stents. And where were we 10 years before? Why didn't we see that coming and stop it? So that's what I do. I kind of call it upstream cardiology. I really want to teach. It could be by book, by a interview, by a clinic visit. And I do take care of a number of people in the UK and around the world by Zoom and Skype and phone. You know, why can't we get earlier in the process? So, you know, the perfect age to start thinking heart disease is probably 10 to 20 to 25 years old, although the audience doesn't really feel they were quite ready for that yet.
So why do you think cardiovascular disease has become such a big issue now? Because when I was doing some research around this, I always knew it was the largest killer, but I was staggered when the World Health Organization said that it kills 15.9 million people every year. And you think about what's going on with COVID-19, cardiovascular disease is like far bigger problem.
We've never really mounted, a shock campaign like we are needing to do right now with COVID-19 to educate the public that, it's over 10 million people worldwide. Most of it relates to high blood pressure. That is the numbers, that is the single biggest slice of all that. Of course, smoking, diabetes, cholesterol. And that largely heart attacks, strokes, bypass, stents, and premature heart deaths, scientifically, we know they're about 80% preventable with simple measures, inexpensive measures, because nobody wants to go to the gym, nobody wants to change their diet. We have convinced much of the public to quit smoking. Fortunately, those numbers are down. They're not zero, but they're down with certain regulations and taxes and such. But you can even do better than that by some advanced further blood work that all executives should know about. I mean, I actually have kind of a viewpoint that it's almost irresponsible to be an executive and not know your cardiac health in detail, because you're not only putting your life at risk and obviously your family sustenance and happiness at risk, you may be putting your very corporate health at risk. It may be very hard to replace you should you succumb to an illness or worse. So why has there been an increase? We kind of see that after World War II and economies picked up, a lot of soldiers came home smokers, free cigarettes and all. There was a real increase over time. We do know this disease is not brand new. We do CAT scans of mummies that are 2,000 to 3,000 years old. We can find calcified arteries as signs of atherosclerosis. There was a very unfortunate, maybe people know the story about Otzi the Iceman, who in Europe fell in a crack in a glacier 5,000 years ago. And his body was almost perfectly preserved, and it was found a few decades ago. But he had atherosclerosis 5,000 years ago. They have actually figured out he had a genetic abnormality by taking some tissue and running gene testing. Pretty cool side story. But we're clearly seeing more. And, we don't eat as well. We have, processed food, fast food, excess salt, excess fats, excess sugars, excess chemicals. We're stressed. We can stay up 24 hours a day and we can work. We can buy garbage food at every gas station and every vending machine. And, we do. We certainly know the importance of exercise, but we've built into so many jobs, sedentary lifestyle. I mean, I'm at a standing desk as I talk to you, and I think you may be too. Yeah, because, that's not a treadmill and that's not a bicycle, but it's at least one step beyond being on your rear end most of the day. And some jobs require that, truck drivers, but anybody gets a chance to get up many times during the day. It's a small little vote for your health.
So now that sort of smoking is on the decrease, is there something else that is like the biggest factor that is causing cardiovascular disease?
If you say what's replaced it, it's probably been the general problem of increased weight, rates of obesity. We talk about, overweight and obesity. That's 75% of the general public. And it probably relates mainly to the changes in the food, traditions. We actually have had, interesting during this exact time of COVID-19, probably a few more home-cooked meals around the kitchen table due to many restaurants and other places being closed. But except for this, 4, 5, 6 weeks, we've just outsourced our food. And it's crazy rushed lives. It's loss of the skills of making a big pot of soup or chili or a homemade bread, because you can control the sugar, the salt, what fats you want in it. You certainly can control if you're adding preservatives, chemicals, and such, and you have no control over that in most of the food industry. It's a very low margin profit industry. I owned as many as 3 restaurants in Detroit over the last 5 years. I'm down to 1. It's challenging, but I've had an inside look at where you buy your product and where you source it. And my restaurants were plant-based restaurants, and we sourced from different providers in most restaurants, and not claiming it was perfect quality. It was much, much higher quality, without a doubt. But, you've really let the other person decide on your fat content, salt content, sugar content. Plus you add in the sedentary lifestyle and lots of chemicals. we do know that obesity is in part, we call them EDC, endocrine disrupting chemicals. They're in the plastic bottles. They're in our air fresheners. They can be in our hand lotion, our facial creams, our shampoos, and they get in our skin. And they say if you put something on your skin within about 25 seconds, much of it has been absorbed, a chemical. That is all outsourced. And maybe we'll take out of this confinement period a little more focus on, buying your own produce, maybe growing some in a garden, and getting back to better food, because it's that weight, blood sugar, insulin resistance, inflammation, kind of 4 factors that is just driving atherosclerosis.